Hey, how you doing? My name's Tom Archer. I'm with Full Body Function, and I have a nice, awesome treatment room right here. Look at the sign at Pure Body Fitness up here in the South End in Charlotte, North Carolina. Today, I want to tell you a little bit about self-care and how to get yourself out of what's called a valgus knee fault. And a valgus knee fault, if you look at Sydney here, I almost said Sydney, maybe Sydney. You'll see that one of her kneecaps, come in here close so you can see this. So you look at one of her kneecaps here is internally rotated, it's pointed like this along with her thigh, and if she wasn't cheating right now and putting her feet in what looks like neutral, but really neutral for her is going to be externally rotated slightly at the foot. So once you'll notice her leg gets just externally rotated here, and this will all of a sudden become straight. Well, somewhere in between there, we have a torsion between the thigh and the lower leg, okay? And that's called a valgus knee fault. What will happen is when someone jumps up and comes down, their knee will be forced in, just like this, and they'll push off, and they'll tear their ACL. So we gotta get this problem out of her because we don't want her to have a torn ACL. And the first thing we're gonna do, we're gonna work on just 3 muscles for self-care, because I don't want this to be too complicated. I want this to be something that you can do. The first one is called the Tensor fasciae or TFL, and it's right here. It's like the 5th pocket on your jeans. So if you're to lay down for me, face down, right here, put that right here, and just with her body weight. I don't want her rolling around or anything. I just want her to compress and just chill and relax a little bit on this trigger point. Is it tender at all? Does it feel like it? Yeah. So right here, and she's going to hang out here for 10 or 15 minutes and let this muscle loosen up. And then after that, she's going to roll on her side. So roll on the side and get right in between. Come down here real quick. So right down here between the top of her hip and the top of her leg. Right here on this muscle, this gluteal muscle called gluteus medius, which is an external rotator, which is what's forcing her into external rotation. And the third muscle, number 3, the third muscle we want to do is the adductor, which is right here on the inside of the leg. So we're going to frog leg her out, just like that. We can have this leg be straight behind her. And just position this right here. It'll feel a little burny right through here, I would imagine, a little ischemic. But we don't want to hurt ourselves. We just want to compress and relax, and try to relax and let yourself sink into the roller here, whatever you want to choose to use. You can use one of these great trigger point rollers or a regular big foam roller. You can use one of those softballs or whatever you'd like to do. But that's a little self-care for the valgus knee fault. Thank you very much.